Behind the need to communicate is a need to share. Behind the need to share is a need to be understood. These words, spoken by the American novelist Leo Roster, echo in the hearts of devoted speech pathologists through their actions and responsibilities. My name is Lyndi and I'm going to share with you the necessity speech pathologists have in the lives of young children with communication disorders. Young children suffering from communication disorders must depend on speech pathologists to invoke specific diagnosis, developmental support, and social interaction skills to aid in the fundamental growth depending specifically on the disorder at hand. As I wish to pursue a degree in speech pathology as a career choice, I'm going to introduce to you the main roles speech and language therapists have in the lives of young children regarding the separate branches of communication. In so doing, I will discuss to you the main priorities of a trained speech pathologist through diagnosis, their stages of development, and social interaction. I hope this presentation helps you understand the value speech pathologists have on young children with communication barriers. To begin, let's focus on the concept of speech pathology. A speech pathologist is one who identifies and manages speech, language, swallowing, and communication disorders. Specifically, language and speech disorders range from acute to absolute communication disabilities through speaking, reading, writing, and comprehending. According to the NIDCD, or the National Institution of Deafness and Other Communication Disorders, 8 to 9% of young children are found with a speech disorder, 5% of whom are found within the age of the first grade and with unknown causes. And approximately 7.5 million of the U.S. population have found to have communication problems. The main goal of the speech pathologist is to assist children in establishing effective communication skills and therapy through specific therapy and individual treatment particular for each child. There are four main distinguished various disorders: articulation, which involves pronunciation or syllable sound issues; fluency, and this can be known as stuttering, involves speech flow and syllable enunciation problems; resonance or voice problems include pitch and volume; and dysphagia or oral issues involve feeding, drooling, and swallowing, which can be very frustrating, obviously, and very uncomfortable. Speech pathology relates directly to the individual in need. Now that we have grown more familiar with the different aspects of speech therapy, let's explore the supporting techniques that speech pathologists use in their field. Communication disabilities can be found into two different categories. One is receptive. This is a comprehensive disorder which involves how the individual understands others. The other is expressive, which involves how the individual at hand communicates with others socially and verbally. Therapy depends on the stage and degree of the handicap. Each child is individual and unique, and therefore needs a unique learning style from their therapist. Sensory training and use of repetition are among these, in which case they will use repetition and sensory fine motor skills to advance their strategies. Visual demonstrations, such as models of mouth placements, will help with precise articulation. And physical and kinesthetic exercises are used for breathing techniques and even play to create a comfortable atmosphere for the child. Also, verbal muscles are identified and understood for precise placement. Finally, in the essence of communications, let's connect the role of speech and language therapy, which has in its realm of social interaction. Keep away from people who belittle your ambitions. Small people do that. But the really great make you feel that you too can be great. This is a quote by Mark Twain, and it relates to how great people who have had to overcome speech impediments to succeed. Such people include James Earl Jones, Marilyn Monroe, and the beloved Winston Churchill. As depicted in the statement, speech pathologists aid in developing the physical abilities and progress of confidence and control. This is done as patients will learn to adapt through enunciation, articulation, and fluency control. Creative concepts will be used with other senses to utilize the student's strengths and ways to achieve success. This also creates different modes of communication and expressions. The speech pathologist will find easier methods children can adopt to strengthen their weaknesses. It also institutes emotional confidence and gives the gift of a voice for those who need one. This voice is a newfound freedom, and that freedom is a confidence to interaction. In conclusion, speech pathologists diagnose, support, and prepare social interaction skills to those suffering from communication handicaps. We have initialized the overall role of speech pathologists, the individual techniques they use in their field and with their patients, and the advancement speech pathology has in the prospect of social interaction. All in all, I hope this speech has well informed you of the speech pathologist roles in the lives of children and has introduced to you a new perspective on communication in our everyday lives. For once said by the European philosopher Ludwig Wittgenstein, "The limits of my language are the limits of my world." Thank you.